Hi guys, welcome back to our channel. A lot of you want to take Botox injections for anti-aging, but you have different perceptions about it. You're not sure what does it mean, what does it do. You see all sorts of Botox and fillers gone wrong and you perceive them as dangerous for your skin. But I'm here to clear all your myths and doubts about Botox, what they are, how effective they are, what are the potential side effects, are there any long-term benefits or side effects with Botox, and everything about it. Before we begin, let's understand what is Botox. Now, Botox is a brand name of one of the most widely used botulinum toxin injections. The product is botulinum toxin. Now, the word toxin might alert you and alarm you, but in fact, this can be compared to any other drug. For example, if you take a drug in a high amount or a high percentage in your body, that could be harmful. But medically, when you use it, these things are very, very diluted to only give you the potential benefits without the risk of side effects. So, botulinum toxin is derived from a small bacteria called Clostridium botulinum, but this is commercial grade and it is prepared in labs under controlled environments. It is not extracted from the nature. This toxin is in fact a neurotoxin, which means it has the potential to relax the nerves in the body and the muscles in the body. Botulinum toxin injections are not only given to reduce the appearance of wrinkles or fine lines on your skin, but they're also given for medical indications like sweating on your palms, soles, underarms, people who develop frequent headaches, in fact for spasms and many other indications in medical field. As dermatologists, we use Botox injections to reduce the appearance of lines on your forehead, on your crow's feet, give you a slimmer jawline by injecting the muscles in your jaw, and also sometimes treat your gummy smile, puckered chin, and whatnot. So let's understand how does Botox exactly work. Botox works by reducing or blocking the nerve signals to your muscles. When your nerves fire, they contract the muscles. When this action is blocked, the muscles do not contract on stimulation, which means the lines that primarily form on your forehead or around your eyes when you express or emote yourself will be reduced in appearance and the face will have a more relaxed appearance. Remember that the effect of Botox is temporary, but it can last for several months. Your doctor might suggest taking a Botox injection, especially if you frown too much, you have forehead lines when you talk, or when you smile, there are too many crow's feet that bother you. Remember that all of these muscles can be treated in one session. Now let's address the number one concern with Botox. Is Botox safe? Remember that Botox is generally safe when provided by a licensed medical professional. Like I mentioned before, for optimal safety and effectivity, Botox is prepared commercially in laboratories under controlled environment. Technicians in the lab dilute and sterilize Botox injections so they do not cause any sort of side effects. Now let's understand how this procedure of Botox is really performed. Before you attempt Botox injections, please tell your dermatologist about your medical history or any sort of medication that you're on. This could include blood thinners, warfarin, aspirin, because this increases the chances of bleeding when something is injected into your skin. Also tell them about any kind of painkillers that you take or any other drug consumption that you do. Sometimes your dermatologist might ask you to refrain from consuming green tea or vitamin E capsules before your procedure, and this is also to reduce the chances of bleeding. They might also insist on avoiding alcohol consumption 24 hours before the Botox injections to reduce the chances of bruising and redness. What you should expect during the treatment: your dermatologist may or may not numb the area before injection, which means they could apply a numbing cream to reduce the pain potential in that area. But remember, this is not a necessity. Botox is usually calculated in units, and your dermatologist should be able to tell you how many units of Botox they're going to inject in you. It's always wise to ask this to your dermatologist to remember it for the next time you take an injection. Some people need 30, some people need 50 or 60 units of Botox. Make a note that Botox is an outpatient procedure. You can walk in, take an injection, and go back to work without any risk of side effects. The pain and discomfort are usually mild and the procedure is over very quickly. What you should know about Botox aftercare: number one, do not rub or press the area. Botox is usually given in small points over muscles. muscles. If you massage, the risk of Botox going into different muscles which we do not want to treat will be high. Avoid any kind of physical strenuous exercises for 24 hours after the injection. Do not lie down for 3 to 4 hours after the injection. Stay upright. Now, how long does it take for Botox to show its effect? After Botox treatment, most patients start getting the desired results in 3 to 4 days, but the results are most established after 2 weeks. How often should you get Botox? Within 3 to 6 months of Botox treatment, your results start to wear off and the muscles start regaining their movement. On an average, the results of Botox lasts for about 3 to 4 months, and that is when retreatment is initiated. Eventually, your muscles will train itself to contract less and you can space out the sessions between your Botox later on. Now let's address the elephant in the room. What are the potential side effects of Botox? Few things are more common than others. Swelling, soreness, redness, bruising. This could happen, but it is not a compulsion. This is more common in people who already have a refractive error, but they avoid wearing glasses or contact lenses because they've been using these forehead muscles to focus. When the muscles are relaxed, their focus is shifted, and that's why they develop a headache. If you have taken Botox injections from somebody who is not very well trained or is not a healthcare provider or a doctor, there could be more chances of side effects. This could mean if the Botox is injected in wrong muscle, you could have a droopy eyelid, upper or lower, or you can have a droopy eyebrow. Now, there are certain patients who should avoid taking Botox, and this is very important. Botox is generally very safe, but if you have a neuromuscular disease, something that affects your muscles or nerves, you should avoid taking Botox injections. It is also not recommended to take Botox while you're pregnant or lactating. If you have droopy eyelids or weak facial muscles already, avoid Botox at all costs. Now, a lot of people believe that Botox will give them an expressionless face. This is desired by some people and non-desirable by others. Talk to your dermatologist before taking Botox what kind of results you expect. If you expect the wrinkles to go away completely, they might inject more units of toxin. If you expect them to only give you certain reduction, you might be given less units of Botox. Some people question whether they will lose their sensing ability after Botox. Remember that Botox only affects contraction. It does not affect sensory nervous system, and there will be absolutely no change in the way you feel things. One last bit on the safety record of Botox, because that's the most concerning thing. More than 20 years ago, a dermatologist and his wife, an ophthalmologist, started using Botox to treat their signs of aging. Today, dermatologists inject millions of patients each year. Be assured that Botox can have really satisfactory results if performed in the right manner. And safety has to be the #1 priority over effectivity. Remember to choose your dermatologist carefully. Talk about the potential benefits and side effects and whether Botox is right for you. Like I mentioned before, Botox is a brand name. There are other 2 brands of botulinum toxin available in India that are approved by the US FDA. One of them is Xeomin and the other is Dysport. You can talk to your dermatologist about any 3, Botox, Xeomin or Dysport. That's all from my side about Botox. If you have a question on Botox to ask me, please put that in the comments. And now that you've watched the video till the end, don't forget to like the video and subscribe to our channel. Up until that, have healthy skin.